This is one of the definitions of community health assessment, which was developed by the North Carolina Department of Health and is contained in their community assessment guidebook. And we'll go through this briefly as a review. So community health assessment is a process by which community members gain an understanding of the health, concerns, and healthcare systems of the community by identifying, collecting, analyzing, and disseminating information on community assets, strengths, resources, and needs. So just to emphasize there, community health assessment is a process. It includes community members, and it involves gaining a better understanding of a community by identifying, collecting, and analyzing information on various aspects of the community. Community health assessment usually culminates in a report or a presentation that includes information about the health of the community as it is today and about the community's capacity to improve the lives of residents. Community health assessment can provide the basis for discussion and action. So again, this emphasizes that a community health assessment itself is an important tool, but that hopefully it will be used as the basis for further discussion, decisions, and actions to improve community health. As a reminder, this is the conceptual framework for patterns of determinants of health as developed by Evans and Stoddart. It includes different components that help to determine health and shows their interactions. We will return to this in just a moment when we talk about community health profile. And by way of review, this is the community health improvement process as developed and published in the Institute of Medicine's 1979 report, Improving Health in the Community. There are two main cycles to this, the problem identification and prioritization cycle at the top, and the analysis and implementation cycle at the bottom. We are going to focus on the cycle on the top in the next slide. This particular cycle at the top contains three different sets of activities. The first is to form a community health coalition. The second is preparing and analyzing community health profiles. And the third is to identify critical health issues based on the community health profile. We will be focusing in the remainder of this presentation on community health profiles. And here is the definition of community health profile provided in the Institute of Medicine's 1997 report. The health profile is intended to be a set of indicators of basic demographic and socioeconomic characteristics, health status, health risk factors, and health resource use, which are relevant to most communities. So a set of indicators containing basic information that's relevant to most communities. The Institute of Medicine went on to describe a few more features of community health profiles. I'll just go through these quickly. It's a set of measures that summarizes the health of a community and facilitates comparisons, both over time and with other communities. In other words, the indicators in the profile can be looked at over time. How are they doing over time? For example, an indicator might relate to causes of death and mortality rates, and one can look at mortality over time. And it can allow also some comparison with other communities to see how well the particular community is doing with respect to the indicators, for example, with respect to deaths from a particular cause. The profile encompasses a broad view of health and its determinants, We'll look at this again in just a moment. It brings together public health, healthcare, and other stakeholders, and it bridges the gap between private and public healthcare systems. It provides a context for work with community issues and priorities, and it forms the basis for decisions on priorities and funds. Within the 1997 report, the Institute of Medicine proposed a set of core indicators which are grouped into 6 different categories. These are listed on this slide. The first category is socio-demographic characteristics of the community. For example, indicators related to age, race, ethnicity distribution, etc. Education, income and poverty. Those are examples. The second category is indicators of health status. Examples include infant mortality, overall mortality rates, adolescent births. The third factor is health risk factors. These are things that impact health status and might include both preventive measures such as immunization rates, but also things such as smoking, obesity, as well as environmental quality issues. The fourth category is healthcare resource consumption. One example was provided of Medicare spending per capita. Functional status is sort of a counterpart to health status, just in terms of how people feel like they are functioning, and self-reported health status is an example of this. Then finally, the last category, profile, quality of life. So this might be, for example, how people in the community feel about their healthcare system. Are they satisfied with it? And are they satisfied with the quality of life in the community itself? Just to put these proposed core indicators within the context of the Evans-Stoddard model, the portions of the Evans-Stoddard model which are highlighted with a solid red rectangle in this slide are the kinds of indicators that tend to be the most commonly seen in community health profiles, those dealing with the social environment, those dealing with individual behavior and some biology, and those dealing specifically with disease. Additionally, some profiles include something about the physical environment and how conducive it is to health. Some may contain information on health and function, how do people perceive their function, and finally there may be information on the healthcare system within the community and resources that are available, the actual use of that healthcare, etc.